or nothing. I don't know what I did. You're good. I actually see you from her window.
Hey. I want to call to order the regular meeting of the Leitchfield City Council. Please stand. We're going to ask Clayton Miller to lead us to the pledge allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have some visitors. It's good to have everybody come out to City Council meeting. We got to apologize. The last two meetings that we had were not televised the way we had intended for them to be. And so we had earlier decided that this would be the last Facebook broadcast, but since we had a couple of glitches on some meetings, we're going to continue the Facebook until the first meeting of September. Then we'll go all to YouTube. So please subscribe to your YouTube channel. That helps. And I think that we've got our issues worked out with our streaming services. We have a pretty short agenda, and we have already been in a meeting. We met at 4 o'clock with Kentucky League of Cities as we talked about the strategic planning. And there was a group of 3 came and took a lot of notes, and they're going to bring us back a report in the next few days, and a full report by the end of the month. And we appreciate them coming down here. You have attached to your agenda the minutes of the regular meeting of July 19th. I've asked, I hope you had a chance to look through those. If you see an addition or changes that you'd like to make, I wish you'd do so now. If you're not, I entertain a motion to accept the minutes the way Lori's typed them up.
I make a motion.
Who seconded it? Tootie Cottrell seconded it. All in favor?
Yay.
Also, we have attached to your agenda the bill list, the bills we need to pay. And I've been depending on Billy Dallas to look over those. Billy, have you had a chance to look over them?
Yes, sir.
Did you see any questions? Got any questions about them?
No, sir, it's cheap. Make a motion, we pay them quick.
I'll second it.
Okay. Motion second. All in favor? Okay. We're down to visitors. We have Mr. Josh Emery, who is Grayson County Citizen of the Year. And we're good to have you here, Josh. Josh and I have been working on a plan to give shots at the fairgrounds during the fair in the Tommy Glasscock building at the end of the fairway. And so far it looks like that's a go, but it's subject to change, isn't it, Josh?
Yes, we are actually making sure that we have adequate staffing. And it looks like everything's going to be good to go. So I just need to contact Tommy and get things rolling that we don't have a problem with offering shots at the fair.
I hope that Grayson County lags behind in percentages of people that's had the COVID virus vaccine. Under the state, although we're ahead of a lot of rural East Kentucky counties, we're still lagging behind. We're hoping that people would take advantage of the vaccine being given at the fair to take those. It's no cost to anyone. And as Josh is wearing his mask tonight, we have some visitors wearing theirs. People that have not been vaccinated need to be, and that we're on the verge of being shut down again. I don't know if the governor will call for that, but if he does, I will follow the governor's orders of what he says. And I hope it's not gotten that bad. But Josh, Grayson County's been plagued with an upsurge of positive tests, haven't they? Why don't you come up to the microphone? I didn't.
First time for everything. Sorry about that.
Yeah.
Yes, Mayor, to answer your question, we are currently seeing an increase of cases. We had a pretty quiet summer, which in healthcare we know We don't say that word, quiet, but we did. And unfortunately, with the spread of the Delta variant, it's looking like that we are having several more cases. Over the weekend itself, we had 50 cases in the county. And that's
Are those
concerning.
all Delta variants?
Well, we really don't know because, the majority of testing that's done in this county is done rapid testing. There are still some places that do PCR.
I see.
The hospital may do PCR testing. We do rapid testing. So we only send off specimens to the state lab to be tested, and they have to go through a certain test routine to screen for those variants. So the state has said that they are estimating around 80 to 85% of positive cases in this state are now the Delta variant. So it's way more contagious. I was talking to Billy, just a minute ago, and he was asking about the increase, and I said, yeah, it seems like this variant is way more contagious. And when we had the other variants, if mom or dad in the household got COVID, a lot of the times no one else in the house got it. But now we're seeing that the majority of the times, if mom and dad has it, or if the kid has it, it spreads through the household. So very, very, very contagious.
Well, I encourage people, what can we encourage people to do, Josh?
Well, right now is the CDC actually came out with guidelines that if you're going to be in an area, and I didn't know how many people would be in here, this is not too crowded, but even if you are vaccinated, to wear a mask, only because the Delta variant is way more contagious. There are instances where people have been vaccinated and they still get the virus, but that should not stop anybody from getting the vaccine, because the majority of people who, if they have a breakthrough case, and that's what we call it, if they're vaccinated and they still get the virus, they don't end up in the hospital, or they, God forbid, they don't die, which is a good thing. So those are things to keep in mind. So yes, wear your mask, if you're going to be in crowded spaces, even if you're vaccinated at this time. Do those basic things of washing your hands, try to social distance, and there's so much misinformation. And right now, what we're trying to do at the health department is we're trying to say, if you have questions, please don't get your information purely from social media. If you don't want to talk to us at the health department, which you're more than welcome to, reach out to us. I'll try to answer your questions. I don't know everything. I'm actually non-clinical. I have an MBA, but I do not have I'm not a medical doctor or a nurse. But I can get somebody who has an answer to that question. But at minimum, or actually probably even better, not at minimum, you should reach out to your medical provider and ask them, whether you call and talk to them or you do a medical visit. So please just get your information from good sources. And always, we're vaccinating. We actually have another clinic Thursday at ECTC. It's 9 to 11 a.m. and then 1 to 3. You do not have to have an appointment. You can walk in. And at this time, we have all 3 vaccines. So we're actually in a position we haven't been in before because of the supply of the vaccine. So many people in the county want Johnson & Johnson, or someone may want Moderna, or someone may want Pfizer. We have all 3, as long as supply lasts. So we're going to continue to serve, and if you have any questions, like I said, just give us a call.
I read your article in the paper, and it suggests the same thing that you did tonight, to don't trust the rumors, and Facebook for your medical advice. Seek your medical advice from a health professional.
Yes.
What percentage has Grayson County had vaccinated?
Well, we're at 40%. That's according to the Kentucky Department for Public Health. If you go to covid.ky.gov, they actually have a virtual map. You can click.
I see.
If you go under vaccine, and then you can look at a map of the state of Kentucky. You can click Grayson County, and then it brings up all the demographics of the total population, breaks it down, how many vaccinated, how many people over the age of 18, how many below 18, how many above the age of 65 or so. Now, I will say that the 65 and older population in Grayson County is like 78% vaccinated, which is wonderful. 40% is also good too. If you go around the map and you look at the other counties that surround us, not to pick on any county, but we, as far as rural counties, we're leading them. So we have a drive here for the vaccine. And as I go out in the community and I talk, and at one time I actually thought this before, and it was a misconception of something I had. I thought we were now at vaccine refusal, and I told you that at one of our meeting, Councilman Embry. But I was wrong, because we set up location tables here in the community, people still have questions. It's not necessarily refusal like I thought. There are still questions out there. So we just have to get the information to people, be patient with people, get along with people, and meet them where they're at, and talk with them and address their concerns. And if you're willing to have those conversations, a lot of times, people will be reasonable most of the time. So again, Thursday, 9 a.m. to 11 a.m., 1 to 3, ECTC here in Leitchfield. Walk in, you don't have to have an appointment, we'll get you taken care of.
And there's no cost to it at all.
There's never a cost for the COVID vaccine. That's also a misconception, Mayor. There's people who've reached out to us and said, well, I don't have insurance. We don't bill for your vaccine, nor does the hospital or any of the facilities. The government has made the vaccine free. So if you can walk in without $1 in your pocket and without insurance, we'll still get you
What
vaccinated.
is the statewide average, Josh? Do you know?
The last time I looked, it was a little bit over 50%, as far as fully vaccinated, I believe. Don't quote me on that, but I think that's what it was more 50%. And what's driving up the percentages is the urban areas, more so Jefferson County,
Yeah.
Places like that where, for whatever reason, people are getting vaccinated more. But the vaccine is available here, so that's not the issue.
What age groups are you seeing now that's more vulnerable? 35 to 50? Or?
Well, if you go by the actual science and what other hospitals are saying, I think here in Grayson County, we're just now seeing the tip of the damage that the Delta variant is doing. But our kids are way more vulnerable than they had been with the previous variants. And I'm going by the science and the reports of what hospitals are experiencing in southern states with an alarming amount of hospitalizations of kids. So, when we first looked at this, we said, well, our most vulnerable people would be people that have, different health circumstances, health issues, or older individuals. But as the variants progress and evolve and change, I think we're all, at this point, vulnerable. So, does that answer your
What's the
question?
youngest age you can get vaccinated now?
Right now, it's 12 years old, and they can only get vaccinated with a particular vaccine, and that's the Pfizer vaccine. And we have that vaccine as well. So the questions we're getting now is, when will people under the age of 12? And I don't have that answer. If I would have been a gambling man, I would have guessed it would have been before school started back, but that didn't happen.
I see.
Do you think because such a widespread right now and it's going faster that people are overconfident and not listening, or?
I think that with this with the virus, and I want to be careful how I phrase this, I think that we've always had a reason to alarm our communities to COVID. However, this variant to me is a little bit more alarming because of the impact it has on kids. So I don't want to say we cried wolf, we didn't mean to cry wolf, we were trying to keep people updated as much as possible. But I just think the virus now is more dangerous than it ever has been. And so, people who've had it and they've recovered, or we were now, this started in March of 2020, and here we are in August of 2021. We're still dealing with it, and people are like, well, I'm still here, or I've had it, or my neighbor had it, and they bounced back just fine. But I think that's to answer your question. I think that the time that we've dealt with this, and I think people just feel kind of strong toward it and like it's not going to touch them or harm them. I think when you combine that with the misinformation that's out there is why we still see a lot of hesitancy for people to get vaccinated.
Are you seeing a lot of repeat people that has had it and they're getting it again, or those that are getting the shots later on having it?
Well, to answer your question about reinfection, so you're asking me is, if somebody has had COVID, and what's the rate of those people getting it again? It's below 50 at this point as far as tracking. Now, that's the number of people we know that have tested positive.
Right.
But we know that there's been people in our community and all over the state and all over the country that probably had this virus at some point and may have not even known they had it. They were asymptomatic.
Right.
So as far as the data, below 50 of what we have. As far as the breakthrough cases, and I said that's what we call cases that when someone's been vaccinated and then they get the virus, it's below 50 as well. I don't have those specific numbers in front of me. It's very rare compared to the numbers we've seen of positive people, which...
You got any other questions, Clayton? Moon, you got any questions?
What type of shot they gonna give at the fair?
At the fair, it just depends. I mean, when is the fair? August 20?
End
It's
of
last-
August, like
end of
last
August.
week.
August
Last
first.
week of August.
I'm still I'm a transplant here to Grayson County, so I'm learning when you all do your all's fair. Burke County, we have it in July, so it's a little different. So I don't think the supply will change much by the end of the month, so we would hope to be able to do all the vaccines. Now, in that type of crowd of people, it may be hard because they're coming to the fair once, and then to follow up with them again to get them in for a second dose. So we've looked at that and we thought maybe the Johnson & Johnson vaccine, but when you get with that, you may have people who don't want the Johnson vaccine for whatever reason. So we hope to be able to offer options, but ideally, to be realistic, it would probably be better to try to do the Johnson & Johnson for whoever's willing to take it.
It's easier to,
One and done
One shot.
versus,
Yeah.
the two, and you're having to follow up with somebody 28, 30 days later, and they may not come back for their second shot.
Tootie, you got any questions of Josh?
No, sir.
Jessica, do you?
I do. I just wanted, is there anything that we can do, the city can do to help the health department get information out, or just anything that you can think of that we can do our part?
Well, Grayson County today just became a red county, and people always ask me, what does that mean? Well, the colors are determined by the state, and red basically means critical spread. And so we're at a critical spread rate, which means it's all around us, okay? So there is a document on covid.ky.gov. I don't mean to keep throwing addresses out, and if you all need me to email this to you, I will as well. Jessica has Councilman Embry has my email. But if you go on there, there's a document that has to do with counties that are specifically red. And it breaks it down. It's common sense stuff, but it's necessarily stuff we may not think about, but having a unified community message. So obviously you guys as councilman and mayor, you guys have a platform to reach several people. You have people in the community that respect you. I'm new to Grayson County. I'm glad to be living here. I love it over here. But I don't know a lot of people yet. You guys do. And I've learned a lot with this vaccine. It doesn't come from necessarily what a doctor says, even though it's important to talk to your doctor. But it's what my neighbor says, or, this person I've known for 40 years that I respect, that I can trust what they're telling me. I've noticed in Grayson County that carries a lot of weight. So we're very community
Obviously, we're
oriented.
divided with 40%.
Huh? Yeah, well,
Obviously,
that's
the
true.
county's divided.
But are we having those difficult conversations? I know that it's the elephant in the room, and if it's going to be a confrontation, I understand you're probably best not to bring it up. I have people in my family and I'm the public health director, that I can't mention it to. But if you can have those difficult conversations, if you can use your platform to voice and to maybe reach out to those people who respect you and know you better than they know me or anybody at the health
Jessica, you got
department.
any more questions of Josh? Billy, do you? Josh, you got any parting words?
No, I just want to say thank you so much for allowing me, I'm getting an echo, for allowing me to come and speak to you guys. I really appreciate everything. It's been a difficult couple years, and I respect this community very much so, and if you guys ever need anything, and I appreciate any help you can
We
render to us.
appreciate the job that you've done, Josh, and what a time to step into a job with this COVID virus. And I think the community owes you a debt of gratitude for your hard work. Thank you very much.
Thank you, Mayor. I couldn't do it without my staff. Thank you.
Thank you.
Hey, Josh, I have a Facebook question real quick for you.
Yes.
Former Councilman Kelly Stevenson asked, are there booster shots coming?
Well, again, I'm a non-clinical person, so I'm just going to tell you what I think, based on what the variants we're seeing, as well as people who, you know, how can I put this? I think, in my own opinion, that we will see a booster shot at some point. But that's me being non-medical and me seeing the variants and the spread that we're seeing. We're going to eventually have to beef up what we have. Does that make sense?
Yes.
I think some of your misconception, and you can correct me if I'm wrong, but people that's had it think they've built antibodies up to where it's harder to get, or they can't, which really, given the shot or taking the vaccine would help more. Is what the things I've read through CDC and in different places. So, your opinion?
The best thing I can say to that is, you know, is to speak to the science, that it's always best, you know, talk to your provider. There is a limit, and some providers differ. I think me and Councilman Embry was talking about the days she works in the hospital. It's 90 days typically that a provider will recommend, but some providers may be a little different. But overall, the message from medical providers that I speak to is it's best to get the vaccine. Wait a little bit, wait those 90 days, recover, bounce back, and then get the vaccine, because it works better than our body, you know, naturally can.
Josh, thank you very much.
You're welcome. Thank you guys so much.
Okay, we have some other visitors. Jeremy, do you want to say anything? Terry, do you want to say anything? Karen? Ruby? Okay, we're down to unfinished business then. On top of the unfinished business is strategic planning. We met about an hour and a half today with the Kentucky League of Cities. They brought down 3 people to meet with us, and they took a lot of notes. And Jessica, tell them what all we did.
So we just talked a little bit about what we saw as our major issues within the city as council members, and then our biggest strengths within the city. And so we spent almost 2 hours talking about just different things with Leitchfield, ways we think we can grow, ways we think that we've prospered already, and KLC is going to take that information back and create some type of a strategic plan for us to work towards, so we can create goals and kind of work together in unity on maybe even like 5-10 years down the road on plans for Leitchfield.
Anybody got questions about anything that was said? We're back to code enforcement, and Clayton gave me a name this weekend of somebody that might fill the 3rd spot, and I told him I'd contact him today, but I've really been in meetings all day, haven't I, Lori? So I'll have to put that off, but we're looking for a 3rd member. I think we got 2 and an alternate, and we're looking for a 3rd member. So if anybody knows, like I said, Clayton, give me a name. I'm going to search them out and find out, and let them understand that it does involve some continuing education courses and such stuff like that. We do have our code enforcement officer here, and our planning and zoning officer is Mr. Tyler Harold. He's given us all a package. Tyler, why don't you explain to us what you brought to us tonight?
All right. Sorry to give you all some extra work, but these are some things that I've been dealing with over the past several months. And another reason why we need to get the board put in place. Put together some packets. This is 7 different properties within the city limits, and there's very many more than these 7, but these
Absolutely.
are all, in my opinion, properties that need to be condemned right away. Each packet shows pictures of the properties, and then there's a description of why my findings. Basically, lack of maintenance is the biggest issue amongst all the vacant properties within the city. They become very dilapidated, they become hazardous, fire hazards, vermin, things like that. But when we proceed with this, I have not sent anything out to any of these property owners yet because we have to, by law, provide them an avenue for appeal, and that is the Code Enforcement Board. So as soon as we can get that in place, we can send these out there. The property owners then have a certain amount of time to either fix the properties, tear the structures down, or they can appeal
To
the
the Code
decision.
Enforcement Board.
Why are we not using ordinances that are on books right now? for
This is
parking?
off of that ordinance. This
We
is
have
off of
ordinance right now on books.
Chapter 152, unsafe and unfit structures.
It has to be taken to court and it gets held up in
The-
court,
But-
right? Isn't that right,
The-
Arlene?
Yeah, but
There's several
we-
issues
The
with
final
the,
appeal is,
there's several issues with the ordinance that's now on the books. There's not an appeals process. It's very vague. There's not a,
So do we need to do away with it?
well, that's what we would be doing with the Code Enforcement Board. It
When-
would
when
be,
it-
Just on them certain ones?
on the unfit structures, it would be
So we have no
replaced.
basis right now to even use them?
Well, the issue is you're gonna have, you don't have an appeals process for what we have in place. So that's one reason I don't believe it's been utilized in the past, is that there's holes there in the process we have in place. Now, the nuisances that we have on the books, those aren't gonna be changed. The only thing that's gonna be changed on those is the penalty phase, how we talked about last meeting, where instead of there being all these different fines, it would all be
So
consolidated.
our ordinances, you have to have an appeals to it.
That's KRS, you have to have an
Yes.
appeals process. So basically, what we would be doing is wiping out the unfit structure ordinance that we have on the books now, and we would have one that would be replacing it.
If
one of the properties that's in this package that Tyler brought us, the Hardin County Task Force went to that for an issue.
There's two of them.
There's two of them. And I had been texting with the former former federal attorney in Louisville, who's from Leitchfield, and he texted me a KRS saying that people that own these properties stand in good light of being able to lose them. And I sent that to Earlene, and we're researching all these avenues to which to help clean up our community.
Right.
How's the demolition house business, Tyler?
We've had one complete. We've got another one in the works right now, or actually two in the works right now, and then I've also issued a fourth demolition permit, and I think a fifth one might be coming pretty soon.
Are you, the one on High Street, isn't it?
I've already issued that one,
Yeah.
so they haven't started yet.
I drove by there, I seen they hadn't started yet.
And then I've had somebody come to me requesting the information.
What else can you tell us about these? I see there's some properties on here, the one on Hilltop. Earlene, if I just read out these addresses, would I be threatened to be sent to court or anything?
I would not do that without giving the homeowner notice,
Yeah.
and that's something that's not
Okay, I
been
wasn't gonna
done.
name their names, just a property address. But anyway, there's a number of properties in here. I'm glad that you're cited and going after. There's, it's a real eyesore. Go ahead, Tyler.
But if anybody wants to do any research on our online ordinances, if you look at Chapter 152, that involves the unsafe and unfit structures, and then KRS Chapter 99.700 to 99.730, it also speaks of dilapidated properties and the process that we have to take in order to get them taken care of.
Okay.
Hey, Tyler, will you quickly go over that demolition program and how it works? I've had several people ask me about it, so I thought there might be other people that just give everybody an idea.
Okay, so any residential property, okay, nothing commercial, it has to be residential properties within the city limits. If it is a structure that they are wishing to tear down and demolish, they can come fill out an application. I'll do a site evaluation and then sign off on it. It's a $50 fee. They dump all debris from the site at zero cost. And then when they're done, they have 3 months in order to get this done. When they're finished, then I have to go back and reevaluate the site and make sure that it's left in fair condition. And basically, it's got to be able to be mowed. You can't just leave something and mow
Tear down
around
the
or
house and
whatever.
just leave it
You
done.
got to take it down.
Yeah.
We did have the first one that was done on Mill Street. We allowed them to leave the basement because she presented plans for what she was going to do, and she was going to utilize the existing foundation to rebuild. So we allowed that to happen, but usually it's got to be taken completely down, but it would be a case-by-case basis.
I intend to ask the council next year, next calendar year, to include mobile homes, or just do mobile homes only for about $150 fee. And there's a lot of mobile homes in Leitchfield that ought to be at the transfer station. And maybe it'll give the owners an opportunity to get rid of those.
And I think we are coming close to the end of that program. I think it goes through the end of October.
I was thinking we went through December 31.
I thought it was from October to October, but
I don't
may be
remember.
wrong, but
You
I'll
may
look
be
back
right.
and see.
We'll investigate that, but people take advantage of that. People that's reading us, looking at us on Facebook or YouTube, take advantage of that. Go to talk to Tyler and get this lined out. It's a good program. Billy, you got any questions for Tyler?
No.
Jessica?
Nope.
Tootie?
No, sir. No,
Clayton?
I
Moon?
talked with him.
Tyler, thank you very much for the work you've done at the pool. I know you had your hands for this year at the pool and doing this other as well. And maybe after the pool closes, you can devote more time to your planning zoning work and abandoned houses. Thank you very much.
Mayor, before Tyler says, Tyler and I met last week, there was one thing, like I'd said before, I don't see a need for us to change the nuisance ordinances except for the penalty stage when the code enforcement board is in effect. But one thing that Tyler had mentioned to me, and something that's in our nuisance ordinances right now, the length of grass is 12 inches right now. Tyler had said that he sees that a lot of people start making calls at like 8-9 inches.
I see.
Some even less than that, but I mean, 12 inches is pretty tall, and I mean, we've
Oh,
got
it is
some out
very
there that's
tall.
like 3 feet and higher.
Yeah.
But we are getting phone calls and complaints on it before it even gets to the 12-inch level, which is in our ordinance.
I see. And you want to lower that then?
I would like to see us amend that and then make a couple other changes as well.
Well, let's, when we when we adopt this new ordinance, so let's do that. I noticed there are some properties that's along the main drag, that's near the ambulance service, that they've done better by keeping it up. And it just helps, Tyler. It makes the community look better, and I'm tickled to death to go along with whatever you suggest, and I think the council would as well. We want our neighbors to take care of their property, and if you could pass an ordinance to give somebody a conscience, we can pass that, but you can't. And a lot of people, every neighborhood's got it. Every neighborhood's got it. I noticed one in here in the K Mill Heights area. It's a disgrace, but I appreciate the work that you're doing. Thank you.
And Mayor, just to talk about timeline, I know last meeting we had said, once that third member is secured, that's when we'll go ahead and do first
Okay.
reading and have that schedule. Is that still the schedule the council and wants to keep?
Sooner the better. We're 2 years into this, really, not by your fault or anybody's fault, but I'm gonna come up with another member between now and then. Like I said, Clayton's gave me a name. I'm gonna talk to them and secure a third member. And well, if anybody knows, I'd say it's not going to be a job to which you'll be richly rewarded, because if somebody comes to before that board that's frustrated that Tyler wants them to clean up the property, it won't be very pretty. And that's the reason the council members and the mayor don't ever attend those meetings, because we don't want to get in that mess. But we're going to find somebody else and to do that. Thank you, Tyler.
Thank you.
Dumpsters.
And you're on, how is it? Mayor, thinking I'm in court. That goes along with the lines of the code enforcement board, basically.
Okay.
And just plan that first and second reading, they're gonna be long meetings. I'm gonna have to have a lot of cough drops and water to
We-
do all that readings.
Okay. Thank you, Earlene.
I think I need a business owner.
Let's go to, Moon, you got anything you want to bring before the council?
No, sir.
Are you sure? Clayton Miller?
Wesley.
Yes, sir.
Last time Heather, the same thing with Scotty over there. Has
Yeah.
anybody been back over there?
We have, and actually Scotty's contracting it is getting me a price on what it'll take to fix that.
Okay.
And when I talked to Chris Smith with Scotty's last week, he's supposed to be getting it to me this week, I hope.
Okay.
So, once I get some numbers, we can see what it's gonna take, and we can kind of decide
Talk about it.
Okay.
what
All right.
plan we need.
You got anything else, Clayton?
No, that's all.
Tootie Cottrell?
No, sir.
You sure?
I'm sure.
Jessica?
I do have a question. Some people have asked me about, has there been a decision made on if we're gonna do fall ball or not? And as far as Parks and Recreation, like the fall leagues of baseball and softball, does anyone know?
Not going to, Tyler? Can't get employees?
We're not gonna do the fall this year. They're really pushing the kid fall league and, trying to get more participants in that. And in past years, the turnout for fall baseball was not very good. So they decided not to have the fall baseball league this year. As far as softball goes, I don't know anything about the softball program, but I do know the baseball program will not have fall.
Okay, there's been a lot of upset parents that were wanting to play fall ball, so I just wondered if we had enough to even have the league, because we have those parks, and I hate to not use them if we have enough kids wanting to play, because they're such pretty parks, and that's why we built them.
Well, you're exactly right. And I said, there's enough people that it ought to be used.
I think you have a problem with employees. Because you got all school kids working there now.
Pretty
And
much all the employees are in school, of course, when they do that, it's in the evening time.
Jeremy, you've been involved with it for 20 years. You got any suggestions?
All the softball parks typically been ran up for keep volunteers, so the employees is the issue. And then also turnout, if you don't have enough kids for two teams, it's kind of hard to justify being in there using.
Turn the lights on and stuff.
you know.
Maybe a call to Tammy
It's
Salzman.
just hard.
Okay.
Jessica. You got any other questions?
No, I think that's
Billy
it.
Dallas?
No.
You sure? Lori, you got anything you want to,
Nope, I'm good.
we've been busy at City
We've
Hall,
had a day
haven't
filled
we?
with meetings.
Yeah. Earlene,
No,
you sure?
nope.
Did you want to comment about that KRS that Joe Whittle sent me? Is there a comment or anything we could say about that?
I don't have anything prepared.
Okay. David Riley?
I do. I have one thing I want to bring before the council. Last budget, they had approved, the council had approved a data system for police records and stuff for $49,800 with a annual maintenance of $75.60. I've been working with that company, and that company cannot provide to us exactly what we need for our records. They're not going to save us any time or anything with our record keeping. So I've been digging, and it was actually put on the new budget, I think, wasn't it, Lori, that put in a new budget? And
Yes,
approved?
we carried it over.
But what I found two data systems that will work together. One of those systems is $7,155.62. And the other data system is $24,041.86 for a total of $31,197.48. And the annual maintenance on both those systems roughly is about $7,000, about the same as the other system. So actually, this is going to be saving us roughly about $18,000. And these two separate systems will cover everything we need covered. They're compatible with everything we need.
Do you know of other departments using the same setup that what you're suggesting for us?
I do.
Are they pleased with it? Are they pleased with?
Yes, very pleased. I've actually talked to about 3 departments.
You know, technology changes so quickly. things that we looked at 2 years ago for other departments in the computer line, when it came up this year, we found out some of that was not as good as what we had been given the impression of. And I would just want to be sure we're going to spend that kind of money. If we're budgeted for that, and it's in the budget, you could spend that.
Yeah, this is, like I say, this is about $18,000 less.
Savings.
Than the original cost was. And I think Billy was actually on that committee for that when we discussed that. And the reason we're even wanting to do this is our system over there is called ProCop. And it's actually about, I know it's 30 years old because I've been utilizing it since I've been there.
I hate getting yearly annual maintenance fees. I like to just buy something and take it home, and I hate to pay so many $7,000 a year for a yearly maintenance fee.
I understand that and I agree with you, but a lot of this is backed up to the iCloud, and that's where the cost is at. And if we tried to store this kind of information here, the cost would be phenomenal. We couldn't afford it.
With those video cameras that officers are wearing, the storage of the videos is where they get you.
It is.
Yeah,
It is.
it's very expensive.
Those cameras are not very expensive, but the storage is.
The storage gets you, yeah. You know, that's where Google makes a lot of their money, and Amazon as well. They're selling storage space to people, these departments and stuff.
So I was just kind of wanting to run this by the council so you guys knew what was going on, see what your all's thoughts was.
If you got it budgeted, David, and it's going to save us 18 grand, we're going to be good with it.
And it's going to serve the purpose. I mean,
Okay.
it's exactly what we need.
Okay. You got anything else, David?
No, sir, that's it.
Wes, Shaw?
No,
You sure?
I'm good.
Y'all might notice the entrance on the left side going out is what the fire department has put in there. And on the right side, it's got the history of the police department in there.
Hey, Mayor. Hey, listen, it's coming. It'll be there next council. meeting.
I do have a question
I'm
for Lori.
sorry.
I read where we got our money.
Yes.
Have we got
884.
guidelines to use it?
They're vague.
They're
Very
vague, Billy.
So,
$884,000,
yeah, something like that.
Yeah,
Something like
isn't that
that.
part of it?
half of it.
That's half, yes, that's
Yes.
half. We'll get the other half about the same time next year.
Some of the things I read was infrastructure that you could.
They said
Water-
specifically water, sewer, and
sewer,
broadband
and-
internet.
Our city lake is very important to us, and it's a backup water system for our fire department. So I don't know that we couldn't classify
What could be done, Billy?
Yeah, we can
leaving.
check it.
I mean, you'd have to get somebody over, and we tried to
Can't the
patch
Corps
it.
of Engineers help us?
They didn't before.
I see.
And we had to go out, contract it, but
They-
Wesley was here when we went over and they
They
tried to
speci-
repack it.
Yeah.
And they told us it'd be about 10 years, and I don't know how long it's been, but it's been about,
It's probably been that long.
but we're losing water, and it's not gonna be a
They
pretty
specifically
sight.
named
I will
water,
definitely check
sewer, and broadband internet. And so
And
we
I
had
wondered-
we had Comcast in earlier, and they talked about the underserved areas within the city limits. And there's quite a bit of them. I've got the map with me. And he's wanting part of that money to extend Comcast to those homes. And it's a sharing. He said they might eat 80% of it if we paid the 20% of it. So they're going to take the clusters of the underserved areas and brought us back. This cluster here, it's got 50 homes in it, would be this. This one here got 7 homes in it, would be as much. So we might decide, we may not decide to do any of it, but it would be a choice by cluster. And that was one of the things. But now I'm for the city lake repair as well.
But Billy, I'll do some checking and see, because I know there's another question I'm trying to get answered for Wesley too.
I mean, we can utilize, I mean, we can show forth on utilizing it for other things other than just pleasure. I mean,
Yeah.
I know we've drawn a lot of water out of it, fire trucks refilling.
The Kentucky League,
Around.
Lincoln Trail said they will work with us on this. The record keeping is tremendous. You got to keep those records to the year 2032. We got to have a plan for it by 2023, wasn't it? Got to spend it all by 2023. But anyway, there's a lot of stipulations to it, and Kentucky Lincoln Trail has offered to help us with it for 0.5%, but I don't know if we'll do that. Okay, Jeremy, do you want to say anything before the council? Pudgy?
No,
Terry? You sure? Karen? Ruby? Matt?
Mayor, I have one quick thing.
Okay.
Tammy Saltzman's watching, and she did say, as far as the recreational programs, that the high school and the middle school kids are playing sports, so it's been kind of difficult, or will be kind of difficult to get players, but she said softball is up in the air at this moment, so, on what they're gonna do.
When does your kickball start? Do you know, Jeremy?
Oh, gosh, I don't know. There's
I mean,
there's an application in
there's a
there on the
brochure
desk,
out, but I didn't
don't
read
know
the
what it
date.
is either.
Do you hear a motion to adjourn?
I make a motion.
Second, all in favor?
You got the old chamber luncheon,
Oh, chamber luncheon, Lori. It was not on mine.
the 12th.
I told you about that.
Well, I know it. I wrote a note that I misplaced. Tell the chamber luncheon.
The next chamber luncheon is August 12th. If you all let me know by Friday if you plan to attend, so I can get those names to April, that would be much appreciated.
We got a motion and a second. All in favor?